Community pharmacies are uniquely placed in the community. I call them sort of the triage room of the National Health Service. I had a man come into my pharmacy. He was very distressed. He had excessive weight loss, excessive thirst, and he was wondering, was there anything he should be worried about? So this immediately set off alarm bells in my head, and I thought, I want to take this man in and give him a blood glucose test. So I brought the man into the consultation room. We did a blood glucose test, and it turned out his blood sugars were through the roof. So I advised this man to go and make an appointment with his GP, which he did, and the GP detected early signs of diabetes. So we started the man on a medication, but more importantly advised the man about diet and exercise adjustments to his lifestyle. So this man came in to see me a couple of days ago. He's had fantastic results due to the intervention of myself as a community pharmacist. He's now stopped taking the medication on the advice of the GP, and he is basically well on his way to being diabetes free.
There was a lady who called into a pharmacy one Saturday. She'd been stung by a wasp and had a mild reaction. I gave her treatment for that and some advice on further symptoms to look out for if they developed. She'd need sort of immediate medical attention, and that was the rash perhaps spreading up her arm, maybe some difficulties with breathing. That was the last I spoke to her until Monday morning when she phoned me to give her deepest thanks for having been given that information. She did develop some of those symptoms and really was developing an anaphylactic reaction. She sought medical treatment and was treated very promptly and made a full recovery, which she said might not have happened had she not been armed with that information about what to look out for. She would not have known that.
Well, an 18-year-old girl visited me in the pharmacy on a Saturday afternoon. She was a type 1 diabetic. And she was injecting her lunchtime dose of insulin and got the needle caught in her shirt and actually caught in her skin. We had a look at it, and after much moving around, we managed to get the needle free, so it saved her a visit into A&E.
The recent Community Pharmacy Northern Ireland survey, the first of its kind in Northern Ireland, has revealed the extent to which the observations and interventions and interactions we have with our patients. It's demonstrated that community pharmacy has over 15 million of these over and above the normal dispensing in a community pharmacy in Northern Ireland. And this translates to over 100 interactions per day with a typical community pharmacy.
Well, I would say that if the doctor's closed, it's better to go to the pharmacy than suffer, or go to any when obviously there's a lot of waiting time and whatever. The pharmacy might be able to help. It's better than just suffering at home.
I had a prescription of tablets that was saying I had a kind of a reaction with them. I would come here and ask for advice on it before I go to the doctor. And it saves my time and it saves the doctor's time.
My children, when they were young, I used to bring them here and they would get advice on cuts and bruises and things like that, or even a bump one time, and they gave very good advice.
Throughout the province I've called various chemists, and they're always very helpful if you want their advice on any medical situation.
Community pharmacists are highly trained healthcare professionals working in a highly trained team of people as well. And their accessibility is second to none within the health service. You know, if you go to any village, any town, any high street in any town or city in Northern Ireland, you can access, without appointment, a community pharmacist and their team.